welcome everybody. My name is Krista Donaldson. I'm with Stanford University's Byers Center for Biodesign. We're so pleased you could join us today. East Africa Biodesign is a formal partnership among 4 universities, and you can see them here: the University of Global Health Equity, the University of Rwanda, Kenyatta University, and Stanford University. And our partnership is really around training and supporting the next generation of local health innovators. And this is with the needs-driven biodesign model started here at Stanford. And for those of you who aren't familiar with biodesign, this is a model that's being used in many universities across the world now. With East Africa Biodesign specifically, UGHE is the lead institution in Rwanda, and Kenya is the lead institution in Kenya. And as mentioned, our collective vision is a vibrant and strong health innovation ecosystem in East Africa that improves health outcomes and health equity. And as part of this work, this joint and collective work, we felt like we needed to better understand and learn from East African health innovators and actors. And so that's really what this webinar is about. It produced a report, and you'll meet the team who did the research. Thank you. But did this incredible research, talking to innovators across the 4 countries. Riantha and Natnal will talk about that in a minute. And the results were a report called Health Tech in East Africa, an Ecosystem Overview. And this webinar really gives a nice overview of this report, and hopefully will encourage you to want to dive more deeply into it. So you see this excellent team who led the work today. Our lead authors, Riantha Pillay and Natnal Abraham, are going to walk us through and give us an overview. Before we get started, though, a few different things. First, we ask that you put any questions in the Q&A box. We'll respond to some of those in written form. The other ones we will save for the end with Riantha and Natnal, and we may be joined by one or more other team members to answer the questions. And then lastly, I really want to recognize our partners in this effort: Vilgro Africa, Wambui Nabaro particularly, Health Tech Hub Africa in Kigali, and lastly, the Bill Melinda Gates Foundation for supporting this work. So Riantha and Natnal, over to you.
Thank you so much, Krista, for that kind introduction. Today, Natnal and I have the pleasure of sharing work that, as Krista has mentioned, is a collective effort of a large and diverse and talented team over the last year. The work reflects extensive stakeholder consultation and was undertaken from May to September 2023. And we just want to start you off here with the fact that it is a snapshot in time. We really hope that this work is going to leave you feeling as excited as we do about this rapidly growing, ever evolving, and increasingly thriving health tech ecosystem in East Africa. So when we talk about health tech, what do we mean? We've taken a really broad and inclusive approach to health tech. So in our report and in today's webinar, when we talk about health tech, we're talking about medical devices, diagnostic equipment, digital health, and over-the-counter consumer products as well. So whilst we acknowledge that East Africa and the East African community is large and growing, with new members continuously being added to the regional intergovernmental organization, our report really focuses on 4 East African countries, with a particular focus on Kenya and Rwanda, which are the locations for the East Africa Biodesign. We've built this work on an extensive collection of work that's come before us, including industry data sources and previous market reports. And we'd urge you to look to our formal report to get a better idea of the comprehensive sources we've used. But I'm going to hand you over to Natnal, who will walk you through some of the primary sources of information that this webinar and that our report is based on. Natu?
So a bulk part of our source of information is the primary research that we conducted. We talked with 116 stakeholders across the 4 countries, and we also had consultation with key opinion leaders. And to validate our findings, we conducted 2 workshops. Looking closely at who were our stakeholders, they were spread across these members of ventures, government, both regulatory and non-regulatories, incubator and accelerators or venture builders, manufacturers, distributors, research institutions, and investors. And when we look at the split across countries, our report is heavily dependent on Kenya and Rwanda, and we do have a number of sources from Uganda and Tanzania, as well as some from East Africa.
Thank you for that, Natu. So in today's webinar, we are theming it around the 5 growth opportunities for health tech, for the health tech value chain in East Africa. This health tech value chain that you see in front of you, this green framework, is really a piece of analysis that emerged from consultations with ecosystem stakeholders. It's a means to organize and simplify something that is incredibly complex and a set of simultaneous processes. Now, the nomenclature for the health tech value chain is by no means universal, and its subcomponents are continuously argued over. So, for example, some of you might call this the product design process. Now, while this might be shown on your screen as consecutive arrows, please recognize that we know that this isn't a linear process. We recognize that it's highly iterative, and based on new learnings from users, things will adapt and change over time. Indulge us as we take you through this very simplified framework to help us all understand. We're going to go into the first aspect now, which is needs finding. And I'm going to ask you to please use your chat function. We want to try and make this as interactive as possible. Give us an idea of how well you know the health tech market in East Africa. We want to know a few things. Firstly, what do you think is annual expenditure on health across the 4 countries? How big do you think the medtech market is across these 4 countries? And as a bonus question, can anyone tell me what you think is the biggest market across Kenya, Rwanda, Uganda, and Tanzania when it comes to medtech? Please, we want to see those chat numbers increasing before I give you the spoilers. I'm going to start giving you spoilers already, everyone. So to give you an overview of the East African ecosystem, yearly absolute expenditure on health in East Africa, and these are 2020 statistics. Kenya, on your graph on the left-hand side in red, accounts for about $4.3 billion US. Tanzania in green, then $2.2 billion. And absolute health expenditure is looking at around $10 billion US annually. If you look towards the graph on the right, we can see Kenya really leading the pack with regards to the highest amount spent per capita at $83 US. Interestingly, though, this is the lowest percentage of GDP at 1.1% in comparison to a country like Rwanda, where 2.5% of the GDP is spent on health. Now, we want you to take away 3 really big points here. The first is that spending across the region lags the Abuja Declaration, this declaration to spend about 15% of GDP towards health. That's the first thing. The second thing is that governments play the largest role in healthcare provision across East Africa. That said, Kenya and Uganda do have sizable private sectors accounting for about 40% of the market. And the third thing we want you to take away from this is that there is a donor dependency in the region. Particularly when we look at Uganda and Rwanda, about 30 to 40% of healthcare spending in both countries comes from donor agencies. Kenya is the least donor dependent, with less than 15% of health expenditure coming from donors. Let's switch gear a little bit then and look at the medtech market. So I asked you how big the market is. Well, annually, $250 million US is spent on medical equipment across the 4 countries. Medical equipment is things like X-rays, respiratory devices, MRIs, ultrasounds. And if you look at the graph on the left-hand side, you'll see Kenya is the lion's share at around $100 million US spent annually, with Tanzania in green at around $60 million US. If you look at the graph on the right, then you'll see that most of these products are originating from China, up to 30%. Laboratory equipment has a slightly different story, with most of it being imported from Germany, but I'll let you check out the report for more on that. So we've given you a little bit of the context of the health ecosystem and medtech market in East Africa. But what we recognize is that needs finding was identified as really an opportunity for growth in the current process. Needs finding and validation is often the weakest point for health innovation, where innovations are not necessarily geared towards priorities of the government as the client, and where there tends to be a technology push rather than a needs pull. Needs finding, which really is the first step and is born out of directly observing the cycle of care and developing deep contextual knowledge, can sometimes be conflated with costly market research, which is decidedly different. There are, of course, exceptions to this, and there are some companies doing this well, which we've highlighted in our report through case studies. You'll see the biodesign process at the bottom in blue, which can be mapped onto this medtech value chain framework. And we think that the biodesign process does well to address this gap through systemic user needs finding and research. As healthcare systems across East Africa undergo devolution and become more localized, like the reforms we're seeing to the Kenyan National Health Insurance Fund, needs finding and piloting are going to become increasingly more nuanced and will need to be tailored to county or state needs and priorities, with variable powers sitting at national government level. And so needs finding then is definitely an opportunity for further growth. I'm going to hand you over now to Natu, who's going to talk to you about tech transfer.
Looking at tech transfer, we're basically going to focus on three key elements: intellectual property and their protection, clinical trials and its landscape, and regulatory pathways or strategies that you can follow to approve your product and get it to market. Starting with intellectual property, here we have intellectual property versus innovation as index. Strong IP protection always have been correlated to derive innovation, meaning if you are in an environment that is protecting your intellectual property, having punitive actions against infringements, you're more likely to see a higher rate of innovation. But when we look at the current status of East Africa, it's lagging behind in terms of the innovation and IP. When we go to the next slide and see just by number of patents that have been filed in 2022, about 502 applicants were filed, and the bulk was in Kenya. That's 83%, out of which 14% were in medtech in regards to today's presentation. But when we put this into a global context, though, it's dwarfed when we compare it to patents that were filed from India, for example, which was over 77,000 just for the year 2022. Moving on to the potential regulatory strategies any locally developer or any entrepreneur can follow, there are four potential pathways. This is to go through your local NRA. This would be, for example, with the Rwandan FDA or Kenyan Pharmacy and Poison Board. There is an East African Joint Assessment. This is a regional regulatory body that has been established and making strides. So you can apply through that. And there is also a potential to apply through WHO collaborative registration procedure pathway. And always the hallmark of regulatory affairs, you can apply with the US FDA. And each strategy brings its own advantage and disadvantage. Starting with advantage, if you can go to local NRA, it's much cheaper, it's targeted, and could be the fastest route to attain a market access. And when we look at the East African Joint Assessment, compared to the others, it's faster, well, especially when compared to WHO and US FDA, and gives you a broader market access more than one country. And then you can target the whole region. When we look at the WHO CRP pathway, it's a very broad market access, meaning it gives you access to the global purchases, especially to public health programs that are NGO funded or the multilateral organization funded, such as by Global Fund. When we look at the US FDA, it's well recognized, it's as I say, it's the hallmark of regulatory approval. And it does give you access to the US market as well. But each has its own caveats in terms of its disadvantages. First, if you look at the current status of local NRA, they're not recommended they're not at the capacity to review the class C and D. And of course, they only pose a small target market. When we look at the East African Joint Assessment, it could be also more bureaucratic. And when we see the WHO CRP pathway, not only does it ask stringent documentation, but it also needs to have, an applicant needs to have a market presence of at least 2 years, meaning it's not for a new developed health technology, but for more established player in the market. When we look at the US FDA, it's relatively expensive. And maybe as a caveat, we can say it doesn't have give you immediate access to European markets, but it's also among the stringent, meaning the pathway that you have to follow would be more cumbersome. Here, I want to mention the CE marking, that's the European certification for a lot of medical devices. When we went to ground and talked to ventures or people seeking the US approval or going to CE marking, they mentioned that the CE marking with the latest update in this guideline have become quite cumbersome and very hard to navigate through and file. So the preferred way had been the US FDA as the current status. So what are key takeaways? The local NRA are not at the stage or maturity to review medical devices. They have put strategies to reach maturity levels, but they are not there yet. They have prioritized biologics and pharmaceuticals rather than medical devices. It will be quite time before we see local NRAs approving de novo medical devices in East Africa. The same can be said in East African Joint Assessment. There hasn't been any precedence of registration of medical devices. And so it leaves you with the WHO pathway if you have prior approval and market presence. If this is the regulatory approval cycle, what does the clinical trial landscape look like right now? Before I go to East Africa, I want to start with the greater continent of Africa because it's completely remains untapped in terms of clinical trials. You can see on the left here, when we compare Africa, the global benchmark, the number of clinical trials conducted the difference is 45x. I will let that sink in terms of how much that is different. Even when we disaggregate across Africa, 80% is just conducted in Egypt, South Africa, and Nigeria alone. So a lot of the East African countries have a lot of ground to cover. So why is this happening? What are the reasons? The reasons are limited incentives. When I say limited incentive is for a principal investigator in a clinical trial, there is limited reputation to be gained. There is also lack of opportunity to find publication because usually clinical trials are being conducted by corporate partners. And also government is not widely involved in sponsoring clinical trials because the focus is rather in health services. So that creates this creator on having limited expertise and also translates into the challenging environment of recruiting patients or people to your clinical trial. But it doesn't mean that there are no opportunities. Africa and East African countries do have ethnically diverse population. There is high disease burden, including non-communicable diseases that are on the rise. There is more and more urbanized population, meaning you can run your clinical trials in a more cost-effective way. If you can go to the next slide, I want to pause here and introduce something. This is an aspect of our work where we went there to talk to ventures and not only take their experience, but bring them into life with cases. Our report contains about 9 cases that we found across the value chain of the innovation, value creation of innovation. And here we have Wikibera. Wikibera is a Ugandan-based fetal monitoring device company. And in our report, you will find that how they faced a challenge in terms of navigating the clinical trials, the fragmented clinical trials in Uganda, and how they resolved it, and ultimately what was impacted in terms of their outcomes, especially in their delayed go-to-market strategy. With that, I will hand back to Rwanda.
Thank you very much, Natu. So far we've been through two of the big opportunities for growth, needs finding and then tech transfer, and Natu went through quite a bit with tech transfer. What we're going to do now is talk about manufacturing, the third growth opportunity. This quote by Millicent Alou, the East African Regional Director for Nest 360, I think is very appropriate at describing the challenges that come with manufacturing abroad, including things like delayed shipping, taxes, and bureaucracy, and its real impact on patient care. We were really struck by the 10 medical device producing ventures that we spoke to during the course of our research. None of them manufactured in East Africa. 6 in Canada, 2 in the US, 2 in other parts of the world, but none in East Africa. Currently, East Africa lacks manufacturing capabilities with near full reliance on imports. So if we look at imports in Kenya in 2019, so this is pre-COVID statistics, Kenya imported $130 million worth of medical devices, whilst its imports were less than $2 million. The pie charts that you're seeing on your screen, the top left illustrates the imports of medical devices by manufacturers from outside East Africa are essentially zero rated. They are exempt from value-added taxation. And thus, we have a situation where imports are encouraged rather than local manufacturing. The other 3 pie charts are there to show you that local manufacturers have to pay costly import duties on key parts to produce medical devices, be that analog parts, electronic parts, or batteries, up to 35% tax. We also want to flag that despite the fact that according to regional agreement, the East African community is a free market zone, in practice, fees are often still charged within the region. So let's then flip gear from imports and let's talk about local manufacturing. The COVID-19 pandemic, with its supply chain disruptions, really presented a unique opportunity for local manufacturing. Local manufacturing and exports increased during this period for products like alcohol-based sanitizers, gloves, and oxygen cylinders. It's unclear how much of this has been maintained post-COVID, now that supply chain shocks have largely been resolved. But we've seen that for Class A and B low-risk, low-fidelity devices, they can be produced locally. A primary driver for why we're seeing this lack of local production is the vicious cycle that you're seeing on the slide. In order to get manufacturing jobs, local manufacturers require certifications like ISO 13485 or GMP accreditation. However, these certifications require capabilities and capital that are only gained through manufacturing jobs. Now, unlocking the growth opportunity for local manufacturing would have many benefits, as we all know. 2 things that we want to highlight. Firstly, local manufacturing can attract government and international NGO funding. So for example, the Rwandan Medical Supplies Authority, this is the public procurement agency, is willing to pay a 15% premium for locally produced goods. This is good for innovators. Secondly, local manufacturing can improve delivery time, servicing, and maintenance compared to import goods. Think about Millicent's quote earlier on. The report goes through a few levers that we think are really important to address in order to promote local manufacturing, and I'm going to highlight them now very quickly. The first lever is shifting the focus of government subsidies and private investment to quality management systems to allow local manufacturers to build capabilities and processes and attain the necessary certifications they require. The second lever is preferential procurement from the government for locally manufactured health tech to encourage innovators to produce locally and increase the number of regional manufacturing contracts. So think about RMS here. And then lastly, the third lever is to reduce import duties and customs on machinery like 3D printers and medical device parts like batteries, which would reduce capital requirements for manufacturers and innovators. Think about those pie charts I showed you just a little earlier. So like Natu showed you the case of Wekabere, I want to highlight the case of A-Light. A-Light is an example of a Ugandan-based startup producing a vein illuminator, which they have designed for local manufacturing. To learn more about how they locally prototyped their device and optimized their manufacturing for scale, please take a look at the case study. It really is an interesting read. Okay, so we've gone through manufacturing, and now we're moving on to funding, the fourth growth opportunity. This quote from David Chen, the founder and CEO of Capsule, which is a Kigali-based digital health tech startup, is something we heard across the health tech ecosystem. It's that foreign educated or expatriate founders seem to receive a greater proportion of for-profit VC funding, and their startups tend to have a longer runway and be able to scale more effectively. David was reflecting this comment to us, highlighting the need for local founders who lack this halo effect to prioritize making customer money as soon as possible. Now, we know that the investment landscape is really different across our 4 countries of interest, with Kenya demonstrating the most robust private capital markets of the 4 countries. But this diagram is a generic look at the continuum of fundraising for nascent health tech innovation. We see early on grant funding and then potentially the traditional VC model. We want to highlight 2 opportunities for growth and 2 major funding challenges that currently exist. Firstly, the grantpreneur model. The grantpreneur model is we acknowledge that innovators, particularly early on in the innovation process, are really stuck in a tough space where fundraising can be really challenging, and they find themselves chasing grant after grant in order to try to break even and further their innovation. The risk of this grantpreneur model, though, is that it can alter the business model and compromise the financial sustainability of the business eventually. The second thing we want to point out is this valley of death that you see highlighted in red. The death valley exists for entrepreneurs between their first round of investment and trying to raise their second round of capital. Now, we acknowledge that some companies should die, and that this is part of the natural innovation process. However, due to a capital-constrained environment, we're seeing really great companies that may have a profound effect on health outcomes and health equity dying prematurely. In the report, we talk about 3 potential strategies that are already being used increasingly in the market and are seen in mature markets. These 3 strategies can be used to really leverage fundraising in East Africa. 3 strategies. Number 1, bridging the funding gap with mezzanine funding instruments like simple agreements for future equity, or SAFEs, and compulsory convertible debt, CCDs, to reduce risk for investors, provide capital for innovators, and shift the funding focus earlier. Number 2 is leveraging interspersed grant funding. So you see, rather than grant funding simply being thought of as something that happens at the beginning of the process, but we leverage grant funding as we innovate or as we enter new underserved markets. And the last thing is emphasizing unrestricted funding. This is funding that doesn't have limits on how it can be used from grant makers or investors, but rather allows innovators who understand the context that they're innovating for the freedom to innovate. I'm going to pause here and then hand over to Natu, who will talk to us about business builders, the last bit.
Yeah, thank you. In terms of business builders, before I dive deeper, I want to start with a disclaimer. When we say business builders, we're referring to incubators and accelerators. But what we found was the word was used interchangeably, incubator and accelerators, rather than the traditional sense of having incubators catering to early stage companies and an accelerator to a bit of more mature companies in the ecosystem. So incubators and accelerators are business builders, and they are playing an important role in East Africa. They're building capabilities, networks, and validating needs. Looking at the example of Health Tech Hub Africa in Rwanda, they take about 5 to 20 people in their program per year, and startups are better positioned after graduating from their course. Startups are a better position to raise more money. And this is one aspect that they're helping. When we take the example of Will Grow Africa, they're doing a lot of work in networking, technical assistance, giving them co-working spaces, and maturing the overall ecosystem. The same was true with Camtech Uganda. They have leveraged the strengths of the local incubators and built a full ecosystem in Uganda. And in the limited scope of this report, in Tanzania, we saw the impact and increased focus of the need for incubators and accelerators. So across the region, these venture builders are playing a major part. And I want to pause here and tell you about one of our conversations with Wilfred Ngaki. He's the co-founder and CEO of Will Grow Africa. This is a Nairobi-based venture builder. And we took two key takeaways that really resonated with us and our team. One was how they look at and prioritize about a team rather than an idea. And a second and most important was the fact that how they focus on social impact being a selection criteria. And he told us and walked us through how that's not a very big stretch to attain. They require each company or venture that is joining their organization to target two segments of the market. 1/3 being customers to be earning below 5% of the per day, and the other 2/3 can be geared to make that company to boost its financial sustainability. So this really resonated with what East Africa Biodesign is trying to achieve in its core goals. Going to the next, so that will be our wrap, and we'll pause here. So we've seen the 5 growth opportunities in health tech value chain, starting from the needs finding, the tech transfer, manufacturing, funding, and business builders. I'll go to the next slide to thank everybody who along with our co-authors who was part of this endeavor. Our helpful gratitude goes to the stakeholders who were gracious enough to take time to talk to us and patient enough to answer our follow-up questions. And on behalf of everybody in the team, I'd like to say thank you for joining us in this webinar. Like we kept mentioning, you can download our report and dive deeper into what we discussed today. Thanks.
Thank you, Natu and Riyantha, for the fantastic and very speedy walkthrough, an incredible piece of work. I'm going to turn to the questions in the Q&A. The first one we have is, and I would invite others too, if you have questions, to please put them in the Q&A too for our authors. And Henry, who's another team member, I invite you to join us too if you'd like. Welcome, Henry. He's another member of this incredible team. The first question is, does the East Africa Community Joint Assessment cover digital health products? And I'm just going to add a second question. Do you have any insights related to that too?
Okay.
Natu, I think you're perfectly placed to answer that.
Yes. So the East Africa Joint Assessment Group, it has set up its functionality. It has published its guidelines, but it's yet to approve any medical products through this pathway. So yes, you can find how it validates and approves a digital technology or any medical devices, but there is no precedence. So there is yet, we have to wait to see it more functional and having applications and processing times be a reality at this moment.
Great, thank you. And we have a second question too, and this is related to regulatory filings, which is of the med techs that were filed in 2020, how were they distributed through the different regulatory bodies? So for example, I believe this is what the intention of the question is, but like across the different countries in the East Africa community, do you have a sense of where more have been filed, where less have been filed? And maybe you could talk about, I know we don't like the term maturity, but the different levels of where the regulatory agencies are. I know that's part of the report too.
So I think the question might have completed two things. So when we look at the regulatory approval, we talked about the class A, B, C, and D. This is the risk-based classification for medical device when you file for regulatory approvals. So we didn't disaggregate the numbers because these are numbers from the regulatory bodies, and they are the one who publish in their website. So we didn't find or disaggregate according to medical devices that have been granted market access through this review. But what we talked about was in terms of intellectual property. So this is new products that are filing for IP. So that's a separate conversation. And when you file for IP, there are a number of approving agencies. So globally, there is the World Intellectual Property Organization, which we in short call WIPO. And then you have the African Regional Intellectual Property Offices. And then this WIPO and ARIPO, they give you access to member countries. And each member country has its mandate to protect your intellectual property. When we look at the disaggregate number across 2022, or the number that I mentioned or shown in my slide today, most of the applicants were through the African Regional Intellectual Property Organization. So they have been filed to the Pan-African authorities for intellectual property. I hope that answers the question.
If I can just jump in there as well to add on to what Natu said, in terms of regulatory bodies itself, what Natu highlighted earlier around the fact that we aren't really seeing de novo devices in Africa being registered and regulated by local NRAs is an important point. And so what we're seeing is that things that are in the market, or medical equipment that's in the market in East Africa is currently going through WHO CRP regulatory approvals, or it's going through FDA and CE markings, and then just getting a tick box or rubber stamp by local NRAs. So if the question was regarding sort of local regulatory bodies' approval processes, then this comment applies. And if the question was about IP regulatory filing, then Natu's answer should take care of it. And if we haven't answered your question, please put a clarifying comment into the Q&A so that we can try to do our best to.
Thank you both. And one more on the regulatory. Are there examples of products that have gone through the East Africa Community Joint Assessment Regulatory Review?
I think I might have addressed it with my first answer, but we yet to see any approved medical device through that joint assessment.
Thank you. We're going to turn to Josh. Thanks, Josh. Given your findings, what does the team believe is the first step towards solving the Valley of Death? So going to funding now.
Thank you so much for that, Josh. I think there are no simple answers. This is something that is seen in mature and other markets as well. This is not a uniquely East African problem, although the capital constraints of this environment make it sort of even more apparent. I think one of the things that we think is particularly important in terms of funding or bridging this Valley of Death is the use of blended finance instruments or innovative mezzanine funding, so that looking at safes and looking at CCDs as a way to try to decrease risk for the investor, but still provide the innovator with access to capital to try and bridge this difficult time. So that would be what we think would be the key lever at addressing the funding gap at the moment. But as I said, there are no simple answers to that question.
All right, we're going to turn to now some compliments to great insights around the Natu. Thank you, Julian. Thank you to you too. He's a team member. I want to recognize. What was personally your biggest surprise takeaway after diving into the East Africa health tech ecosystem?
That's a tricky one.
Mm.
Natu, do you want to kick us off, or are you going to put me under the...
Perhaps. I think going back before going to Rwanda, Kenya, and Uganda, we did our desk reviews, literature reviews, and we did not expect the amount of actual ventures going on. I was particularly surprised and taken back when I went to Uganda and saw the Virgin ecosystem with medical device. So that was the biggest highlight. And talking to ventures such as Wikibera, where they start their innovation cycle from personal experiences or having to lose somebody, and thus they try to mitigate that problem from such a personal reflection. So that was the biggest surprise and the biggest takeaway for me.
I like that one. I think mine is going to be a big takeaway rather than a big surprise, and a confirmation of something that I've long suspected. It's very common to attend a webinar like this and for Africa, the continent, to be painted with a singular brush. And having spent time in East Africa and learning about the East African market, these are 4 countries, and in fact, the East African community, 8 countries that are exceedingly diverse with very different go-to-market strategies. And market access really differs between these places based on ease of doing business by the government, who is the largest, who holds the power with procurement, what role do private markets play, and how easy is it to mobilize private capital. And so even when we do assessments like this or reports like this where we talk about learnings across East Africa, I think the biggest takeaway for me is just how nuanced it is. And the most striking differences was our 2 countries of interest, Rwanda and Kenya, have really different ways that you would need to go to market in order to be successful with health tech. And so I would urge anyone who's in the industry or wanting to get into the industry to really dive deep into the contextual knowledge, because simply looking at these things from a macro zoomed out approach is not going to be enough. And so not a surprise, but definitely a big takeaway.
Sorry, go ahead. Go ahead, Andrew. Yeah, thank you.
A major takeaway. One thing I think we also noticed when we were there is just like beyond just kind of like doing the desk research, is there's just a huge sense of growth, I think, in the region and movement. Things are really happening. Players and different government authorities are forming and making goals and trying to hit them. And there are a lot of ventures that's kind of not too noticed. It was just kind of the whole region seemed to be really pushing towards like in assemblage of just a lot of growth, which I think is a really positive thing and something that really struck me when I was there.
Thank you to the 3 of you. And this is, I think, a related question, and turning towards innovators, which is actually the focus of this work and the focus of our East Africa Biodesign program. What do you think or hope is the potential, or what can be done to encourage innovators? And I know that's what the report covers, but maybe 1 or 2 takeaways kind of following on your last comments too, from an innovator perspective.
I don't mind hitting us off with that one. So I think for me, the big takeaway for innovators is really this need for needs finding, that there needs to be a, rather than a tech push, which is always a risk in technology, there really needs to be a needs pull, user-centered deep dive into what's happening, an observation of clinical care all the way across to billing, to really understand what's happening in the area that you want to affect some sort of change or affect some sort of solution. Because without that really deep contextual understanding, it's going to be hard to succeed in this region.
Yeah, I think
Yeah,
you took
go ahead.
my answer, but she reminded me of the conversation that we had with the head of Health Tech Hub Africa, and he was saying that a lot of innovators are solving the wrong problems, and we need people to solve the right problems.
Great. Thank you. We're going to turn back to regulatory again and the question of AI. Do you have a sense of how insight, and I'm skipping over all the compliments, by the way, team, but congratulations on great work. But do you have insights on how AI may affect regulatory pathways? For example, products where software can be updated with AI-enabled diagnostic. How do you see these medtech companies and regulatory bodies taking on this aspect of AI-enabled products?
Mm-hmm. That's a very good question. And so in terms of the maturity of the regulatory authorities, they are growing. So I think it will be covered in terms of the scope or with the new guidelines they would publish. Even, for example, in Rwanda, there is another government authority that is specifically working for the AI and technology regulations. But in terms of having the actual regulatory affairs giving you approval for your new updates or the AI-driven technology, I think you would still, the way the status quo is set up, is you still need to have approval from major regulatory affairs that are quite established. So having the CE marking or the FDA approval, whatever things are changed over there as they are used as a reference regulatory authorities in East Africa, I think complying with those two major organizations would be the key to go, or that's how I see the impact of AI and how it will be regulated.
And just to flag that in the report, we do talk quite a bit about data protection and some of the regulations around data protection across the 4 countries of interest. And at this point, we see that, it will always be aggregated data is the one thing, and that offshoring of data is a major problem. So none of the countries at the moment without special permissions are allowing you to offshore data. And so this will have implications for building out AI models in the long term. But I would say, to add to Natu's comment, this is regulatory bodies the world over are trying to learn how to deal with AI, and we're still in the early stages in East Africa as well.
And just thank you. One of our commenters also added a note saying, well, FYI, while no medical devices have been approved via the joint assessment, multiple devices are currently in the review. So thank you to that commenter for adding that. And I think that's an important thing to remember too, is that this research was done largely last year. And while we have followed up with updating some of the data, keep in mind that this is a snapshot in time of the East Africa ecosystem. I'm going to turn back to another question regarding intellectual property. Is the sense that IP is not well protected not worth filing? I don't think that's what you're saying, but I would love to hear what you're saying. Or is low level of filing due to the lack of knowledge to file IP?
I think I might have not made my point really clear. Is the current status is changing. We went to talk to a few lawyers in Rwanda as well as Tanzania, and new rules are coming up. When we look at the macro level, the punitive, or if somebody infringes your IP, the punitive punishment are not really massive, and agencies that are mandated with that task are not well resourced at the moment. Thus, yes, IP and its policies or protection in East Africa is at its earlier stage, but it's quite evolving really fast. Maybe Rianta, you can add some of your insights as well.
I think Natu said it really well in that damages are low and surveillance is, like anywhere in the world, is something that startups have to do by themselves. And so if you have a situation where surveillance is very expensive and damages are low, the incentives to file for IP are not as strong. And so that's one part of the conversation. The other part of the conversation is particularly for startups that are spinning out of universities. What we're hearing is that not the belief and the knowledge and the know-how of how to file for IP and comfort that you will get real protection in filing for IP is growing, and at this stage is relatively low. So I don't think we're here to sort of answer the question directly. I think we're hearing a number of different things from the ecosystem, but largely that incentives don't seem to support encouraging filing.
Great. I'm going to take a question from the chat now, and actually, Rianta, you can stop sharing. Thanks. It's great to see the two of you. Big screen, thank you. Or the three of you. So what do you think are the key big right problems to focus on, to go after right now? And I'm going to say, because we don't have Naresh, thank you for the question. I'm going to say, I don't know, maybe you can answer from a government standpoint or regulatory or just in general.
That's a challenging question because I don't think that there's right or wrong. And I think that this will depend what stakeholder, like I guess you've nudged us to, Krista, this really will depend on what stakeholder perspective you're taking. From the point of view of governments, potentially the priority is about how to increase ease of doing business, encourage local investment, and encourage local manufacturing. Those might be the three big things that from a government perspective are key priorities, but that's not necessarily the same key priorities as the innovator might have. So I do think it's a great question, but it does depend on who you are in the ecosystem. And maybe if you can give us an idea of what perspective you're coming from, it might help us to answer it sort of quite more aligned to you.
Thanks. Why don't we... Yeah, sorry, and I'm happy to go to the next question too, Naresh. In the meantime, if you want to say what perspective you're coming from, unless Natu, you have additional comments you want to make.
No, I was just thinking if you're talking from the government bodies or the bodies that are regulating IP or medical devices. I think the biggest challenge is capacity and capacity building strategies. Like it's not just about earning the degrees. It's like, how do you regulate them? What do you do with the new guidelines, or how do you fit like global guidelines to your settings? So I think in terms of capacity building is where I would start and focus.
I'm going to jump around. I've been trying to do the questions in order, just being respectful of our audience, but I am going to jump to the last one because it's related to capacity, not to. But for the group, how can we better engage and build capacity of governments to accelerate, incentivize, and strengthen the health innovation ecosystems? And are donors doing enough? These are big questions, I know.
Yeah. I'm going to give someone else, and I'm throwing someone else under the bus to start off, but I do have a something to say on this regards human resources. But
well, I will say, as you know, I think one of the important things with East Africa Biodesign, I mean, that is one of our goals, is to engage and support the capacity of the ecosystem in general. And I say we, East Africa Biodesign, collectively are 4 universities. And I think that this report is a first step in understanding what the levers are around accelerating, incentivizing, and strengthening. And so I think the 5 main points too that our team has raised are important starting points. I think the question, are donors doing enough? I think the answer is always like, no, we'd love them to do more. but at the same time, there is an active investment in supporting local innovators, which we think is incredibly important, and there's models to learn from. I think India's growth of the health innovation sector, its support with the Stanford India Biodesign program, active work being done in the ecosystem there by state governments and national governments. There's many models we can also be learning from. So I'll just say that to kick us off and go back to our experts here.
If I can sort of build a little bit on what Chris is saying, and this is particularly around human capital development, I think one of the big areas that we need to see more on is investing in things like biomedical engineering. So if I can give you a little bit of a snapshot, about 100 graduates out of Rwanda annually. And if you looked at Kenya, there's 2-degree programs on biomedical engineering. I think 17 institutions that are offering sort of technical degrees or diplomas, but 2 to degree level. And this is sort of, to me, a real lever for change and an opportunity for growth, is looking at how we can invest in human resources that will become the experts that will go on to inform the national regulatory authorities, whether that's IP or clinical trials or whatever. They will be the innovators of the future. They will be the policymakers of the future. And it's really about investing in this key resource, which I think we are seeing a lot being done at the moment, but it's definitely, to me, a key area of development.
Great.
I will also say, I think it's very different depending on each country. I don't think that there's a singular, like, I think the way in which, like, especially Rwanda and Kenya, for using that, operate very differently as a government structure. And therefore, like, the ways in which you want to, like, accelerate or incentivize or strengthen their health innovation systems are going to look really differently.
Yeah.
Thank you. We're gonna do a rapid round of questions because I am committed to us ending on time. A question: what are the other major non-funding challenges that are killing companies in the Valley of Death? If any.
So, yeah, I think that there are a few. So when we're talking about non-funding, one of the big things is around this clinical trial gap. So one of the big issues is that early on, you can have some sort of prototyping, but you will need to move from these prototypings to pushing into doing things like getting regulatory approvals or protecting your IP or deciding where you're going to manufacture. And all of these things are non-funding related challenges that present uniquely overlapping at the same time as this valley of death, where you're moving from an early business with an idea and a minimal viable product through to a business that's ready to really access the market and move towards scale. And I think essentially all the challenges we've identified are all contributors in some way to this valley of death.
Thank you. I'm going to end with one more question. First of all, thank you all for the many, many questions you're asking. The last one is just, what's the best approach to build capacity in an HR perspective, so human resources perspective? Yeah. If you have any thoughts on that, and we'll end with that question.
I think it's having to set a strategy, not just on immediate needs but on the future goals. Even I was a former regulator in East Africa from Eritrea. One of the experiences that we always sought after was, you can have short courses, small affiliation with universities, but essentially it comes to the functional or processes of doing the actual work. So having affiliates with perhaps a more established regulatory authority. For instance, if the Ghanaian FDA is more established, having a small fellowship where your regulators can actually join and learn on the job. I think those are what we're really missing in terms of the HR capacity and regulation.
Thanks, Natu. So first of all, thank you to the team. And also I thank you to our colleagues, Deja Hill and Meghana Nirkurar, for their help this morning with the webinar. And thank you all for joining us. And please download the report, and we're happy to answer any questions offline. Just contact any of us. Thank you.